Tonight, they're calling it the Better Care Reconciliation Act, but it's really just the Senate's version of Trumpcare 2.0. So the question is, what have Donald Trump and Mitch McConnell cooked up in secret for the health care of you and your family? Well, tonight we go through the details and debate the bill's political futures. Plus, expert analysis of the Senate Trumpcare bill, what it means for patients and providers from the former CEO of a regional health care network, and from the former moderate Republican congressman from the Hudson Valley. And later, the legislative session comes to a close in Albany, and no one is left town satisfied. What lawmakers got done and the major things they did not. Bridge naming proposals has some people fuming. Good evening, everybody, and welcome to RFL. I'm Richard French. Thanks for joining us this Thursday evening. Now, after months of waiting and weeks of secretive meetings that even some members of their own caucus were excluded from, well, today, Senate Republicans pushed all their chips into the center of the table and bet their Senate majority on a stingy repeal and replacement for Obamacare. Now, the bill, it appears focused on accomplishing three things for the GOP. For Senate Majority Leader Mitch McConnell, the focus was on a bill that actually repeals and replaces that can still get enough votes from both moderates and far-right conservatives. A tough needle to thread. Also, it's to roll back enough Obamacare taxes to make a major tax cut package possible in the very near future. McConnell's other goal? Well, that's to get a bill to President Trump's desk so he can sign it and claim victory, and do it theoretically before the 4th of July. But this bill would impact health care for every American, and not all in ways that will be easy to spot. So what we did was we asked our senior political correspondent, Andrew Whitman, to run through how the Senate bill will change health care for you and for everyone else. Andrew?
Well, Rich, there's a lot to go through, but in a nutshell, the Senate's Trumpcare proposal would have two major impacts. It would provide less coverage for more money and would produce nearly $1 trillion in tax cuts, mostly for the wealthiest Americans. But they say the devil is in the details, so let's pop the hood and check what's powering this latest version of Trumpcare. First up, how many Americans will lose coverage under the Senate Trumpcare bill? Well, we don't know. The CBO will score the bill as early as Monday. The CBO estimated 23 million people would lose coverage under the House's version of the bill. Early estimates suggest 19 million or more might lose coverage under this Senate bill. Next up, premiums and deductibles. Again, we await the CBO score on Monday, but given other changes that we'll cover, it's hard to see how most premiums and deductibles, even for people who get insurance through work, don't go up if this bill becomes law. You'll pay more. To insurance subsidies, they would be cut and then eliminated. The Senate bill would cut most subsidies for people who use insurance exchanges by about 15% over the next 2 years. After that, those subsidies would be eliminated. Insurance companies estimate they would have to increase premiums by about 20% to make up just for the loss of those subsidies. Seniors will almost certainly pay more for health care under this Trumpcare bill. Trumpcare would eliminate the cap on how much more seniors can be charged than other people can be. And unlike the House bill, there's no cap at all on senior premiums. The House bill did have a cap. As for Medicaid, the Senate bill inflicts more pain on the program and its enrollees, but it takes longer to get to that pain. The Senate would end Medicaid's expansion, but it would do it in a slower fashion than the House bill would. But in the end, the Senate would cut even more out of Medicaid when all is said and done. On mandates, the Senate bill would eliminate the individual mandate. That's the requirement that all Americans must have health insurance. That will hurt the bottom line of insurance companies and likely lead to higher rates. The Senate bill also eliminates the employer mandate. So you would no longer be guaranteed to have health coverage if you have a job. And that would also likely lead to higher insurance rates, even for people who get their insurance through work. Addiction care. The bill's hit on Medicaid would reduce or eliminate addiction coverage for 1.3 million people or more, depending on how states handle the Medicaid cuts. But the bill does provide $2 billion additionally to finance 1 year of addiction coverage. But that is well below what most experts think is needed. Experts think we need $190 billion over 10 years. That's $19 billion a year. Even moderate Senate Republicans have asked for $45 billion over 10 years. That is far more than this Senate bill is actually offering. The Senate's Trumpcare bill also targets abortion and reproductive rights. The bill bans any plan that receives a subsidy from covering abortion. It would also block all federal funding for Planned Parenthood for a year, and it would prevent women from using Planned Parenthood for contraception, STD testing, and more. The Senate's Trumpcare bill eliminates all of the popular protections from Obamacare. It would allow states to eliminate requirements that policies cover a host of popular items, including outpatient care, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse, prescription drugs, rehabilitation, lab services, preventative care and chronic disease management, and pediatric care. But the Senate would require that insurers cannot block coverage for anyone with a pre-existing condition. There is a major cap on this, though. There's nothing to cap or limit the premiums for people with pre-existing coverages would face, so you'd be able to get coverage, you might not be able to afford it. And the real story of the Senate's Trumpcare bill may be on taxes. The bill eliminates 5 different Obamacare taxes for a total savings of nearly $1 trillion. So who benefits? Well, the top 1% of earners would save about $400 billion out of that trillion. The top 20% of earners would save about $640 billion. Finally, the bill would keep the controversial Faso-Collins amendment. That rule, which only applies to New York State, would force the state government to pick up all of the Medicaid costs currently paid by counties, except, of course, for the 5 counties in New York City. The upside is those counties would be able to slash their property taxes. The downside is that rule would cost the state government about $2.3 billion a year. Governor Cuomo, who despises this amendment, says for the state to make up that gap and not cut any services to do it, taxes on middle-class New Yorkers would have to go up about 26% to cover the difference. Rich?
Andrew, thank you. Now there's a lot to digest and discuss about the latest GOP health care proposal. We're going to get to the politics in our next segment, but first, we want to focus on how the bill would impact you and your medical care. Now, Jim Foy spent 17 years as CEO of the Riverside Healthcare System. It's a group that operates 4 major healthcare facilities, including St. John's Hospital in Yonkers. Now he's a partner in Hudson River Capital, a private equity firm focusing on healthcare startups in Westchester. Jim, as always, good to talk to you.
Nice to be here.
Again, there'll be a lot of amendments to this, but we've seen what passed in the House, and now we're seeing a version, while different, bearing a lot of the same similarities to the House version, in some ways even more draconian. Let's start with Medicaid, because we were talking before we started that for a lot of people, they hear the word Medicaid and they get an idea of some 20-something-year-old who won't get off of his or her duff here, who's up to no good. In reality, the people and the institutions that rely on Medicaid as a major funding, I think might surprise the general public who they are.
You're absolutely right. I mean, one thing that people don't understand is 2 out of 3 people in nursing homes are covered by Medicaid.
Yeah.
It's a middle-class, working-class person who's worked their whole life, spends through whatever assets they have, because nursing homes are expensive, somebody providing care for you every day, and then Medicaid picks up their coverage. Again, 2/3 of the people in our nursing homes are covered by Medicaid. Other piece that's hard to believe and dangerous when you think about it, it's over 50% of the births in the United States. Now, depending on the cuts in Medicaid, and I agree with you, these cuts seem to be worse even than the House bill. I think some insurance executives yesterday in New York State, there were 10 of them who said that they expected that under the congressional plan, Medicaid reimbursement would fail to meet the cost by 25%. That'd be catastrophic for a place like St. John's, for a place like White Plains Hospital. You're talking about hospitals that don't have margins of more than 1%. A lot of times the margins are negative because you're taking care of uninsured people, you're running emergency rooms, there's a lot of different things. And from what I've seen of the Senate bill, it's kind of devious in a way. The first couple of years isn't as bad for Medicaid, so I guess somebody who's running for re-election can say it's not that bad. But over 10 years, they're saying it's hundreds of billions of dollars worse than the $800 billion reduction from the House. So it's kind of like, okay, let me get through one more election, and then we'll cut the hell out of it.
And it's a double whammy for states like in our metropolitan market here right now. New York takes a double whammy out of this.
Yes, they have a special provision. I don't know all the details, but those states that are considered with richer Medicaid programs, and it's kind of a funny term to say richer Medicaid because Medicaid doesn't provide anything other than the basic services, but they get a special cut. And I know at least New York and Connecticut, under the current version of the Senate bill, would get a special cut. It's adding insult to injury.
You know, the one refrain, nobody thought Obamacare was perfect, that the ACA didn't have flaws. But the argument that says, hey, you know how much the insurance companies are finding this unaffordable? States sometimes have only one carrier. Some states are even throwing their hands up altogether and can't do it. How much of that, Jim, is because it is an unsustainable model versus how much of the unknown has been injected into this in the last 150 days, because you never know when the next shoe's going to drop?
Well, it's two things. First, if you look even before the election in November, you had states like New York and California that embraced it, that had 10, 15 insurance companies that were participating. Granted, New York State and California are larger states, but I think the key difference between a New York State and I think Tennessee has none, or Iowa, is that the state embraced it and worked with it. Secondly, as you said, with the president now coming out and saying, I'm not sure if I'm going to give the subsidies and we're going to revoke this and the system is dying, he's encouraging the insurance companies to pull out, and lo and behold, they're pulling out. It can be a self-fulfilling prophecy, which is, it might be fine in political terms, but it's really terrible in human terms.
You know, the thing I was thinking of before we sat down was, I remember before there was an ACA, that you had 50 million people without health insurance, but we always threw the number around. But at St. John's, when people walk through the ER, it's not like you said, I'm sorry, show me your insurance card, you got to go the other way. That was their first and last resort here. You guys had to open your doors and take it. I think people forget. People were screaming about the fact, forget the morality for a minute. It was unsustainable for hospitals to, on the arm, take care of everybody that came through their doors. Are we going back to that potentially?
I think we are. But the problem is we're going back to that with even less resources to take care of it. So we've seen hospitals closing in Westchester. We've seen hospitals dramatically reduced in size. You're just going to see more of that. I mean, there's no question. And
I remember years ago when I came to the hospital, we had done a story. One of the worries was, because there was no ACA or at the time, when a patient's released after they get the care, there was no aftercare when they had to go to do a sixth-floor walk-up or whatever else. This attempted to address that. And whether it was completely successful or not, it was certainly better than where we were before. And that's another concern people are saying is, again, you have that safety net, and maybe that's not even the right expression, but that goes away again.
Yeah, and that's, in addition to being cruel, that's going to cost us more money in the long run. They need the home care. They need the education at home. They need the follow-up care with their doctors, or else they're going to be back in my emergency room in 3 weeks and then in for another stay of 7 or 8 days, which costs so much more than all of the home care and doctor visits would have cost. And it's cruel, and it's eventually going to kill them.
Last thing, and that is, you look at the polls. Whatever people might have thought in the beginning about ACA, Obamacare, whatever you wanted to call it, they like it a lot more. It's not even close than what they're calling Trumpcare now, whatever this version turns out to be. Do you think it took the last 150 days for people to all of a sudden realize, wait a second, I actually have something and I can lose it, and this is what it'll look like? Do you think that people will finally understand what it is that they have once it's potentially going to get taken away?
I hope so, but I'm concerned that that isn't the case. If you notice, and again, this is all these cuts are being proposed to decrease tax rates. I mean, that's the only reason. The benefit is tax rates are going down. No one in their right mind who's a politician would ever propose these kind of cuts to Medicare, because they know people who have Medicare who are over 65 vote in much higher numbers than the general population. In the same way, people in poverty vote less than the general population. So I think they can get away with it, and I'm afraid they will. The other piece that I didn't mention that I wanted to is the hypocrisy. When you hear all of our elected officials rightfully complaining and saying what a terrible thing we have going on now with the epidemic of opiate. Yeah. Well, Medicaid is the largest provider. We're going to cut it 25%. Secondly, if you look at the commercials on the exchange, what they're proposing is that any state can give a waiver to an insurance company where they don't have to cover maternity care, emergency services, and mental health and addiction services. So we can talk all we want about what a terrible problem this is, but, you know, we don't put our money where our mouth is. And it's also funny when you think about maternity care that they're eliminating. It was, my understanding, it was a group of 12 men who decided that maternity care isn't an essential service.
Bunch of white guys in a room. Right. Jim, I appreciate it. We're going to see how this all plays out. There's tons of political division. We'll get into the next segment, but I appreciate your time.
Thank you very much. Good to see you.
And coming up next, the politics of this new Trumpcare bill. Some Republicans already saying they can't vote for it, at least right now.